Do medical costs really account for the majority of personal bankruptcies? I'm sure you've heard this on many occasions. It's so well established in the vernacular that we all just think medical costs represent more than half of the bankruptcies in the United States. The problem is, like many other things that people just don't take time to think through, we've been duped. Like the plastic straw controversy in California. Remember that last year? All based on bad science, because it really wasn't science. It was a fourth grader doing a research project. It's all based on people who want to take power away from you and to give it to themselves to tell you how to live your life. And the same thing here. And unfortunately, people who should know better, they fall for it, hook, line, and sinker. So let's dive right into this here, my friends. It's just another thing that you've got to be always on guard. Here's NerdWallet. And so how did I come to NerdWallet? Because I was reading an article in the New York Times where it's referenced the healthcare costs represent over half the bankruptcies in the United States. And I said, well, let's leave where that article took us. And that article took us to another article that said the same thing, but it didn't say that, just said it explicitly. That took us to another article which said the same thing, but it didn't state it. And finally, there was another article linked back to this, which linked back to this study from Harvard. It's insane. It's like a maze. All these articles state it. It's like because they keep stating it, it makes it more and more prevalent, and more people say, hey, look, the New York Times says it must be true. How did the New York Times say it? One of their authors from the New York Times wrote out about it from some real left-wing rag, and I said, okay, let's follow this. How did they say it? Well, they referenced this article in New York NerdWallet. Where did this come? Well, they referenced this other article, which referenced finally the study. So let's dive into this. So here's NerdWallet. Finds medical bankruptcy accounts for majority of personal bankruptcy. So now this is the basis for a lot of different theatrics, shall we speak, on medical bankruptcies, accounting for over a majority of the medical costs, accounting for the majority of the bankruptcies, based on this, which is based on something else, which I'll share with you in a second. So this is what everybody references. So if you think about the links like you see in the internet, all right. So we're going to show what I'm talking about here. If I can find my So we're going to have all these articles all attributed to this one piece right here, which is what we're going to talk about. All right, so you're thinking, okay, all right, that's great. So all these different reference points. And the funny thing is, this one will reference that, they'll reference each other, and it is a vicious cycle as if it's more legitimate because all these articles are referencing each other. And then finally, one references this. It literally took me like 3 or 4 links to get here. And I was like, okay. So now you're thinking, okay, that's great. So that must be the source of the study. Well, it's not. So here's this article here, which everybody's referencing. And the case study, the ultimate source, is right here. And we're going to dive into that here in just a second, which is, jeez. All right, so let's look at this. 1 in 5 American adults will struggle to pay medical bills this year. Let's see, how do I make this bigger, man? I thought I could do that just by clicking this. It doesn't look like it wants to work. All right, so anyway. In fact, medical bills are the leading cause of personal bankruptcy, a last resort after millions of families have drained their savings, maxed their credit cards, and even refinanced their homes. To further understand the complexity of health costs, NerdWallet has compiled a series of estimates highlighting the strain of medical bills in 2014. All right. They estimate, NerdWallet does, 56 million Americans under the age of 65 will have trouble paying medical bills. Over 35 million Americans will be contacted by collections agencies for unpaid medical bills. I just had one. I literally got something in the paper from a collection agency from unpaid medical bills. And the reason was because we never got the bill from the beginning from stupid Aetna. They sent us a check for $1,500. Like, okay, we thought it was a refund from our Cobra. So we spent that sucker. And then 6 months later, they said, oh, no, we got a collection bill saying that wasn't supposed to be to you. It was supposed to be to your healthcare provider. We're like, okay, we didn't know that. We just did what you did, fool. But we got a medical collection. Jeez Louise. About 17 million Americans will receive a lower credit rating on account of their high medical bills. I agree with that without question. Over 15 million American adults will use up all their savings to pay for their medical bills. All right, well, I mean, that's what do we quantifying a savings. We're not going to dive too deep in that, but just, okay, what are we quantifying savings? A checking account? Nearly 10 million American adults will be unable to pay for basic necessities like rent, food, and heat due to the medical bills. Over 16 million children's households struggle with medical bills. Despite having year-round insurance coverage, 10 million insured Americans aged 19 to 64 will face bills they're unable to pay. I mean, yeah, okay. We'll face bills. We all face bills we're unable to pay. I hate to say it. That's the nature of and I mean, 10 million. That's not a huge amount. It's a lot, but it's not the same as over half the bankruptcies are caused by medical bills. Look, I'm faced with, I can't pay that bill right there. I don't have the cash on hand to pay that freaking $1,500 collection I got from stupid Aetna because they screwed up. All right, so guess what? We make do. 1.7 million. Okay, so here's a kicker. 1.7 million Americans live in households that declare bankruptcy due to their inability to pay their medical bills. 1.7 million Americans live in households that will declare bankruptcy. So, see where we're going with this, the manipulation of the verbiage here. I have a household of 6. 1.7 million live in households, so the household's big. The 1.7 million, the household's a unit, but we have each household, let's just say, has 3 to 4 people in it. All right, so that would be, let's just divide by 3. That'd be what, 600,000 people will declare bankruptcy due to their inability to pay medical bills. That's a little bit different than 1.7 million Americans live in households that will declare bankruptcy due to their medical bills. But no, look, trust me, it gets a lot worse than that. 3 states account for over 1/4 of those living in medical-related bankruptcy: California, Illinois, and Florida. Well, I mean, okay. To save costs, over 25 million Americans will not take their prescription drugs as indicated, including skipping doses. Okay, I don't know how you say that's attributed to saving costs, but whatever. Okay, and look, we have too many prescription drugs as is anyway, so that doesn't bother me in the least. But I want to go back to this. 1.7 million Americans live in households that will declare bankruptcy due to their inability to pay their medical bills. Is that true? So let's see. Methodology and resources. All right. Baseline estimates of U.S. population in 2013. We estimated the population based on U.S. Census data for total population, blah, blah, blah. All numbers were calculated off the U.S. Census data. All right. We already know that there's some issues with the U.S. Census data when it comes to income, but I'm okay using that for population. I don't have any problem with that. Americans struggling with medical bills. There is significant variation estimates by the U.S. government, nonprofits, and think tanks. We use the most conservative government-provided statistics released this month by the CDC, Centers for Disease Control. Bankruptcy. So Americans struggling with healthcare bills. Okay, so that's different than the bankruptcy numbers here. So Americans struggling with, I'm struggling with healthcare bill right here. Absolutely. Okay, but that's not the same as bankruptcy now. You see how these things get convoluted. We relied on a widely cited Harvard study published in 2009. NerdWallet chose to include only bankruptcy explicitly tied to medical bills, excluding indirect reasons like lost opportunities. Thus, we conservatively estimated medical bankruptcy rates to be 57% versus the author's 62% of U.S. bankruptcies. We also use official bankruptcy statistics released this month through March 2013. So they're relying on this Harvard study and throwing out some of the shenanigans that are in there, and there are legion. How many in there? Interesting, huh? So let's take a look here. So now that is what they're using. They're using prescription drug use. At this stage, I don't care because I'm going back to this right here. 1.7 million Americans live in households that will declare bankruptcy due to their inability to pay their medical bills. And we go down to their methodology. Bankruptcy relied on a widely cited Harvard study and published in 2009. So let's just go to the crux of the matter, shall we? I'm going to go to what you want to see. Oh, man, they got rid of one of my quotes. Man, that's too bad. So let me bring up my other one. But anyway, this article is why you can't trust NerdWallet. Sorry, folks, it's badly researched. No way could you have read the Harvard study and came to this conclusion. Man, I can't believe they got rid of my comment here. That's bad. I don't know why they didn't get rid of this one. All right, so that's okay because I kept it and I got the studies that we're going to reference. All right, so let's go first and foremost to the myth and measurement, the case of medical bankruptcies. And while I'm doing that, let's see if I can't find in my data set. Oh, they got rid of my comment, man. I can't believe it. Oh, that's nuts. That's nuts. Hold on just a second. They did. They got rid of it. That's okay because we commented. Man, I wish I could get. This is Myth and Measurement: The Case of Medical Bankruptcies, and this is from the New England Journal of Medicine. All right, wow, New England Journal of Medicine. That's a legit place by Carlos Dobkin, Amy Finkelstein, Raymond Klunder, and Matthew something, all three PhDs. Anyway, all right. I wish I could make this bigger. Oh, there we go. Sweet. There we go. Okay. Due to the push to pass the ACA, the Affordable Care Act, Obama often described the crushing cost of healthcare with those causing millions to live every day just one accident or illness away from bankruptcy, and repeatedly stated the high cost of healthcare causes bankruptcy in America every 30 seconds. Stories of illnesses and injuries with financial consequences so severe they cause households to file for bankruptcy were used as major argument in support of the ACA. By Elizabeth Warren and Sheldon Whitehouse, cited medical bills as a leading cost for personal bankruptcy when introducing the Medical Bankruptcy Fairness Act. But it turns out the existing evidence for medical bankruptcy suffer from basic statistical fallacy. When we eliminated this problem, we found compelling evidence that the existence of medical bankruptcies we found compelling evidence of the existence of medical bankruptcies, but discovered that medical expenses cause many fewer bankruptcies than been claimed. Policymakers believe about the frequency of medical bankruptcies are based on primarily two high-profile articles that claim medical events cause approximately 60% of all bankruptcies. Let's go back to NerdWallet. Where did they get their numbers from after they deleted my quote? Let's see. Bankruptcy. We relied on a widely cited Harvard study published in 2009. Interesting, huh? That's one of the main two. And these studies, listen to this now. In these studies, people who had gone bankrupt were asked whether they experienced health-related financial stress, such as substantial bills or income loss due to illness. People were also asked whether they went bankrupt due to medical bills. People who reported any of these events were described as having experienced a medical bankruptcy. This approach assumes that whenever a person who reports having substantial medical bills experiences a bankruptcy, the bankruptcy was caused by the medical debt. The fact that, according to the 2014 from CFPB, which is Elizabeth Warren's baby, about 20% of Americans have substantial medical debt, yet in a given year, less than 1% file for bankruptcy, suggests that this assumption is problematic. Clearly, many people face medical debt but do not go bankrupt. Even after correcting for overly broad definitions of medical expenses, the existing widely cited evidence on medical bankruptcy is built on the fallacy that when two things occur together, there's necessarily a causal relationship between them. Let me just repeat this. The Consumer Financial Protection Bureau, and this is in 2014, before my man Mike Mulvaney took over, when Elizabeth Warren and Barack Obama were still, this is their baby. They were in charge of it. They had Richard Cordray. I think he ran for governor in Ohio and didn't win, but he was the guy in charge. This is a corrupt politician like you would believe, and he was in charge of CFPB based on the false premise to begin with, which is what it was created for. Now, they say this approach assumes that whenever a person who reports having substantial medical bills experiences a bankruptcy, the bankruptcy was caused by the medical debt. The fact, according to this own firm, government protection agencies theoretically, about 20% of Americans have substantial medical debt, and yet in a given year, less than 1% of them file for bankruptcy. Now you can I'll put all this link in the show notes. So let's go over here to this is Gail Harriet, and she had written this. We'll see, what are we at? All right, so while the study takes the position, this is, all right, actually, I just got to remember where we're at, number 3. All right, so let's go back to, again, I've done another video on this before. This is from Gail Harriet. She's on the Consumer Civil Rights Commission. She's a law professor at San Diego, and she had written this in 2006, a comment on illness and injury as contributors to bankruptcy and the media publicity surrounding it. I tell you, man, if you ever need to be just dismayed by the media and its ability to change the dialogue. I mean, it's scary. It's literally scary what they can do here. All right, so this is Gail Harriet, who now sits on the Civil Rights Commission. I think she's been on there for a while. Only 28% of debtors cited illness or injury as among the reasons for the bankruptcy. The authors concede that earlier studies came to very different conclusions. So let's go down to this here. I tell you, man, because I'm telling you, you're probably scared poopless about all this with the bankruptcy stuff. Study about medically related bankruptcy, broadly defined, not medical bills. Let me pause. I want to show you something. I'm going to pause. One of the most cited studies. The authors state that their study classified bankruptcies in which the debtor cited uncontrolled gambling, alcohol, or drug addiction, death in the family, and the birth addition of a new family member as having a medical cause, but not necessarily even a major medical cause. It is true there may be situations in which a researcher might legitimately want to classify those conditions as medical, but a study touted by one of his authors as showing a broken healthcare finance system is bankrupting middle-class America is not one of them. And who's the author of that? Elizabeth Warren! A father who has gambled his family's mortgage payment is not likely the victim of a crushing medical bills, and reforming the healthcare finance system will do nothing to solve his problem. Similarly, new parents who find that they no longer can afford their previous lifestyle and that one of them has had to stay home with a baby will usually find the OBGYN's bill the least of their problems. Babies are a financial hardship even when the hospitals give them away for free. Man, and this is what led to the beginning of Elizabeth Warren's political career, and Elizabeth Warren as using the CFPB, which Richard Cordray was in charge of, which even just before 2014, while Obama was still the president, simply said that 1% of Americans file bankruptcy in the United States in any given year due to medical stuff. All right, that's just come on. All right, so let's keep going down here. Let me pause again because I want to. Here we go. The higher the proportion of bankruptcies attributable to such misfortune, i.e., you had a horrible illness and you just can't do anything about it. It's crushing you with debt, and you're going to file bankruptcy. The more lenience the public may agree to in the formulation of bankruptcy policy. But there is far less agreement that debtors beset by gambling, alcoholism, or drug addiction should be protected by the easy availability of the bankruptcy option. In fact, some would probably take the position that holding such persons accountable for their debt would be therapeutic. Classifying gambling, alcoholism, and drug addiction with those involving traditionally defined injury or illness only serves to confuse and mislead the reader. That's by design. That's by design. All this, however, is just one among many ways that illness and injury as contributors to bankruptcy cause illness and injury to appear to play a larger role in bankruptcy than they actually do. While the study takes a position that over 54% of all bankruptcies have a medical cause and 46% have a major medical cause, it is important to note that only 28% of all debtors questioned for the study cited an injury or illness as a reason for their own bankruptcies, and even that figure is bloated. The authors gave debtors an extensive list of possible reasons for the bankruptcy and encouraged them to check all of those that applied to your situation. Among the reasons: job problems, illness or injury, divorce or family breakup, may lose home, victim of fraud or crime, addition of a family member, gambling, trouble in managing money, employer's business failed, car accident, something else. What? The 28.3% figure was attained from the results of this question. Any bankruptcy of a debtor who cited illness or injury as of self or family member was counted as having major medical cause, regardless of how many other reasons were also cited by that debtor. The study fails to make this clear. Although it states that some debtors cited more than one medical contributor, it fails to make clear that some debtors no doubt checked both medical and non-medical reasons for their bankruptcy. Some maybe haven't checked all 16, and yet some bankruptcies were still nonetheless recorded as having a major medical cause. All right, my friends. So the point about this, and this is the point is just you've been duped. We've all been duped. My man Mark Kohler, who's a CPA JD, was duped. I interviewed him for the podcast the other day, and he said bankruptcies, more than half of bankruptcies are attributed to major medical problems. It's simply fake, man. It's fake to get the ACA for Elizabeth Warren to launch her career politically based on fraudulent. Her book is now literally it's like Michael Bellis's. If you ever follow the Second Amendment debate, there's a guy named Michael Bellis's who wrote on the framers didn't really like guns and blah. It was completely fraudulent. Doris Kearns Goodwin, all right, fraudulent, and yet they're still out there. I think Bellis's is probably not nearly as well received as Doris Kearns Goodwin, but it's all fraudulent stuff, man. I mean, it goes back to weapons of mass destruction. Fraud. We fell for it, hook, line, and sinker. And once you see how much you've been led to believe the fraudulent stuff, you can't unsee it. And it's sad because there are reasons why people need help and they need assistance with medical illnesses. The hospitals don't care about you. I tell you, I'll share the story. When Chloe was born and she was at the UVA NICU, the bills are piling up. And there's a guy I knew, I wouldn't consider him a friend, but he was an okay guy. But he was very active politically and was a rising star on Republican politics. And he had a daughter that had some illnesses as well. And one of us got their medical bills wiped off by the hospital and one of us did not. You want to take a guess which one did? Yeah. So it's political, man. It's all political, and you can't help it. You can't not believe that. And once you go down this road, you say, wait, they lied to us about weapons of mass destruction. They lied to us about the causes of medical bankruptcies. What else are they lying to us about? And that's what the whole point of my YouTube channel is. It's all a lie about your inability to retire, to keep being a cog in the machine, that you can't enjoy your life. And the sad thing is that's what they want. And they want you to do what they tell you. They want you to live in fear. And like I was saying last night in my live video, I have a lady who saved up a boatload of money, and she wants to leave her crappy old job, but she's scared. She's scared because of health care. And I said, she got well over 500,000 saved. I said, well, you go on Cobra for 3 months until your new job kicks in, and your new job, your premiums will only be $240 a month. But she goes, well, what happens if I can't do that? I said, what do you mean? She goes, well, it's going to cost $1,000 or even $2,000 a month for Cobra. I'm like, it's for 3 months. For 3 months. So you're going to stay in your crappy old job, which is literally killing you, to avoid paying $2,000 a month for 3 months, and then later on down the road, not only is it only $240 a month, but you have health care for life because it's part of the government. And and she's a smart lady. I just sitting there thinking, I don't get this level of fear that's out there. It's sad. It's sad. And I'm trying to say, look, you got the money. I mean, you got $500,000, no debt. But the fear is, what if, it's sad. Don't let that be you. Remember, you're being duped. Everything you read, you've got to go in there assuming it's being duped. And the sad thing is most people won't because it's hard. All right, we'll see you next time.